So good afternoon, everyone. Thank you to the organisers for inviting me to speak. So just as an introduction for people who don't know INPUD, the International Network of People Who Use Drugs, we're the global peak body representing people who use drugs, working to protect their health and defend the rights of people who use drugs. So I asked to be part of this panel and be part of this section because I actually wanted to be a bit of a critical voice to this, what I see as this conflation between so-called addiction or drug dependency with mental health conditions and disorders. And I think it is concerning because I think we are oversimplifying, what a very complex phenomenon. They are not one and the same thing. Many people who use drugs amongst the community, including people who use dependently, would argue that presenting people who use drugs as people with mental health disorders, is stigmatizing and pathologizing in and of itself. I think often we think simply label or changing the labels of people who use drugs from criminals to patients, is an all-in-all positive thing and that it immediately removes the stigma. But, in a lot of ways, it mainly replaces or displaces one stigma with another. So instead of people being, labelled bad or immoral, people who use drugs become mad or sick victim. And yes, that's not to discount that there is a whole mental health and neurodivergent movement, that also pushes back against, paternalization. But I'm also not sure that, bridging or conflating the stigma produced by both ends up breaking the stigma of either. I think it ends up confusing what are two very distinct areas and experiences, and this can lead to, misdirected, even if it is well-meaning approaches. So how are drug dependency, mental health conditions, or psychiatric disorders different? Well, for one thing, drug dependency, or so-called addiction, it's not a fixed thing. Many of us do not perceive it as a disease. People enter and exit drug use and dependency all the time, unlike some mental health conditions which are much more fixed. It is true that there's some correlation between the two, but again, it's complex. For instance, drug-induced psychosis is a temporary problem or temporary phenomena. A lot of the time, if we're talking about the stimulant use, it can be solved with sleep and food. And it's true that many people do self-medicate, with drugs to self-regulate how they feel. And though I know that clinicians are trained to think that this is always a bad thing and that it will lead to disaster, I can say that I've seen many, many people and heard from many, many people who have done this successfully, and they see drug and alcohol use as really having been beneficial at some period in their lives. I think many people, and it's an issue we need to look at, really try and avoid the clinical environment as much as possible. I think many people don't do well with authority and want to avoid overly intrusive interventions, having to constantly explain yourself, and that there's a loss of power that comes with turning over decision-making over your own body and minds to, so-called expert. I think we have to understand these decisions as essentially rational. I think a lot of the time people just assume people who use drugs, must be irrational, but there are reasons why people would prefer to, access street drugs, say, or illicit drug market, than go to a clinic. I think empirically we can also see that mental health disorders and drug use dependency are not one and the same, at least from a community perspective. The thing is, when people are presenting in front of doctors or clinics, psychologists, psychiatrists, it's usually when things are at their very worst. So I do think doctors and psychiatrists, you only see a small microcosm of somebody's life. Where as a peer, as a community member, as a friend, we see the fuller picture of people, the motivations and experiences, right? We see all the complex and subtle and not so subtle reasons people start problematic drug use again. But again, it's not often a lifelong condition. Many people who use drugs don't have, wouldn't identify as having mental health conditions or disorders, and many people with mental health conditions, don't use drugs. And even in cases where there is a correlation, it doesn't mean that there's a causation. Whilst it's true that there may be higher rates of mental health issues amongst people who use drugs, I'm not sure why, or I think we're too quick to jump to the conclusion and attribute it to drugs, right? Rather than looking at the stress of living under prohibition. You know, there are so many things in modern life that create mental health issues, you know, social media for one. So why wouldn't we recognize, you know, the fear of being arrested, denial of freedom, denial of access to children, employment, social isolation and stigma as creating mental health issues and disorders themselves. So I do think a lot could be gained from pulling back from this impulse of problematizing, you know, addiction as something wrong with the brain, and instead really seek to understand, you know, that there are sociological critiques of addiction science which really problematize how we perceive things and how the way that we perceive things actually creates, you know, problems themselves. So just in looking at, you know, integrated care, you know, of course there's a place for it, but also want to urge caution that sometimes there's a lot of ways in where it's done poorly. You know, for instance, I see a lot of harm reduction clinics, they impose mandatory social worker and psychologist visits, and if you don't attend them, then they can withhold your dosage. So in terms of destigmatization, of course, I think work needs to be done for both in terms of to destigmatize drug use and dependency and also mental health. And there's a, you know, whole list, I'm sure, of what could be done. I won't obviously go into them here, but I will mention, you know, one important piece, I think, of destigmatization work, and that is really supporting user and person-led approaches and movements. You know, I think people need to not only see the client who is dependent on the practitioner for their benevolence or health or help, but also as empowered and autonomous advocates who have a right to participate in their own treatment decisions and to also shape how the world sees them. I think we need to better support and fund user-led and community-based interventions and have people most directly impacted designing and implementing them. And there is a whole body of literature out there on why this improves access, quality, and acceptability of approaches. But I think as long as we label people as disordered and irrational, you know, this change in a system that we know isn't working, the current system isn't working, as long as we do that, you know, this change is never going to happen. So I'll finish with my remarks and looking forward to the discussions. I also know there's people with lived experience in the audience, and it'd be great to hear of their experiences.
Thank you very much, Ching. Thank you very much.
As well.